Hello, thank you for your interest in HIMPLANT subcutaneous silicone penile implant procedure. We are proud to offer appropriate candidates the opportunity for penile aesthetic and reconstructive enhancement using an FDA-cleared medical-grade silicone implant. We have performed thousands of procedures for over 2 decades, and we are excited that you are thinking about HIMPLANT. We look forward to discussing the procedure with you and answering any questions you have. As with any surgical procedure, it is important to begin with realistic expectations. This is a surgical procedure that has provided great benefits to patients and their partners, including higher self-confidence, self-esteem, and self-image. A multi-year study shows that the majority of patients experience these benefits, not only in the short term but over many years. Patients have reported that the procedure can be positive in terms of satisfaction with love life and overall lifestyle. We have typically seen increases in penile girth of 1 to 2 inches over the course of the months after the procedure. Because the implant is placed under your skin, most men notice an improvement in the apparent length of their flaccid penis over time. Any changes in the apparent erect penile length are unpredictable, and if they occur, they may take months, a year, or perhaps even longer to materialize. As with any procedure, individual results will vary by patient, with actual results higher or lower than these past averages. These are simply past statistical results and are in no way a guarantee or warranty of future results. Finally, while these changes are substantial for most patients, please do not expect that your penis will suddenly triple in size. As with any surgical procedure, it is important that you carefully and completely consider the possible risks, complications, and alternatives, including no surgery, and will be discussed further in this video, in the written materials you have received, and in person during your office visit with the medical staff. While we have seen high success rates with this procedure over the past 2 decades, it is important to consider the possible risks and complications in detail. The clinical staff is available to discuss your questions in the office, over the phone, or through video conference. And before your procedure, we will go through the informed consent process again, and you will again have an opportunity to ask any questions and to make a final decision on whether to proceed. Always know that you can cancel your procedure at any time. The surgeon may also cancel your procedure at any time, including the day of the surgery, if the surgeon does not believe you are a good candidate for the surgery. Patients who are smokers or who use any tobacco products must stop smoking or using any tobacco products months before and after the procedure. Please be aware that our clinical observations indicate that former smokers or users of tobacco products are at higher risk for complications. If you are a current or former smoker or user of tobacco products, you must consider the risks of this procedure with particular care. Patients who have undergone any previous penile surgeries, including enhancement surgeries, must inform the medical staff in advance to determine if you are still a candidate. Patients must also not be suffering from any major health issues, such as uncontrolled diabetes or severe infectious disease. Patients must also stop the use of aspirin or any blood thinners weeks prior to the procedure, but only after consulting with their primary care physician or cardiologist. Finally, patients must agree to strictly adhere to all post-operative instructions. Any non-compliance with post-operative instructions will likely result in complications, including the possible need for implant removal. It is critical that all patients follow all post-operative instructions to minimize the risk of post-operative complications and side effects. The clinical staff will be available every step of the way to answer your questions in the post-operative instructions. A few areas to highlight in the post-operative care include abstinence from all sexual activity, including masturbation, until you receive clearance from the medical staff, which typically takes at least 6 to 8 weeks after the surgery. You must avoid any heavy lifting until you receive clearance from the medical staff, which typically takes at least 6 weeks. You must also avoid strenuous upper and lower body exercise until you receive clearance from the medical staff, which typically takes at least 4 weeks after the surgery. The clinic will discuss your overall recovery plan and when you can return to certain activities based on your occupation, hobbies, body's response, the state of your recovery, and other factors. For example, occupations that require prolonged walking or standing, a special uniform, or a high possibility of physical trauma will require specific timelines for activity and post-operative care instructions that will be discussed with the medical staff. The objective is to ensure your safety and minimize the chance of complications. Certain post-operative instructions apply to all patients. You must strictly avoid the use of penile stretchers or any other external penile device. Use of these devices is against medical advice and may damage your penis and the implant. You must avoid examining, manipulating, or bending your penis until you have received clearance for sexual activity. Premature examining, manipulating, or bending of the penis can damage the implant and sutures. It is expected that you will have some level of swelling, redness, discomfort, etc. for a few weeks after the surgery. Examination of the area of surgery needs knowledge and special techniques and needs to be done by a medical professional. Any kind of manipulation could cause you serious damage as you heal. Following the procedure, please do not submerge yourself in any body of water or visit any saunas until you receive clearance from the medical staff. Moreover, please do not shave or cut the pubic, penile, and scrotal area for at least 1 week before the procedure and several months after the procedure. If you form any cuts or infections, please inform the medical staff immediately. Your skin is your first defense against infective microorganisms, and your skin's health is critical. It is critical that you maintain close communication with your implant surgeon, and if you cannot visit the clinic regularly after the procedure, that you send post-operative photos of your penis to the clinic in multiple angles according to the instructions provided to you so that the medical staff can be apprised of your healing progression. These instructions are examples of post-operative care instructions that you must maintain. Your surgeon will share a copy of the post-operative instructions and will discuss it in detail with you before your procedure. Non-compliance with post-operative instructions, such as rigorous exercise before proper healing or early sexual activity, including masturbation or use of any external penile devices, will likely result in serious complications that could include infection and implant removal. Please note that complications requiring implant removal generally necessitate an additional procedure, which may cause scarring and may put you at a higher risk of potential complications, thus requiring a post-removal rehabilitation regimen. As with any surgical procedure that involves an implant, there is a risk of infection, which may result in implant removal and post-removal rehabilitation. Your surgeon will work to minimize this risk by prescribing antibiotics, using antibiotic solution before and during the procedure, as well as employing other means. Please be sure to take all your prescription medications as instructed. Moreover, because of the swelling and stretching of the penile skin after the surgery, you may experience a change in sensation, which typically returns after your penile skin has adjusted. Patients may experience a temporary hypo or hypersensitivity of the penis. Due to the nature and quality of the patient's skin and how prone he is to scarring in general, patients may experience scarring, fibrosis, or keloid formation. We have protocols in place post-operatively to help minimize scarring. However, scarring may nevertheless occur and in some cases may result in retraction of the skin. You may also experience some kinks or bending of the implant, which may be normal or a result of the scar tissue formation. This may be treated through medication or surgically. Finally, you may experience painful erections, typically for the first few weeks or so after the surgery. This is due to the expansion of the penis and the changes in penile size. Intense erections may cause a detachment of sutures. Your surgeon will work with you to minimize the occurrence of these complications by decreasing erection intensity for the first weeks after the surgery. Our team is here to help you. We invite you to carefully consider your options, and if you are a good candidate for this procedure and you decide to pursue it, you must commit fully to following all pre- and post-operative instructions. Please note that the size of the implant will be determined based on the current size of your penis and the nature of your penile skin, and it will be based on what can be safely placed in your body and what will ensure the best aesthetic result. The implant is trimmable by the surgeon to ensure a custom fit for each patient. Patient safety is paramount, and therefore, patients cannot select the size of the implant themselves. Finally, this is an elective procedure. You have the choice not to undergo the procedure at all. Before choosing to have the procedure, you may participate in sessions with a licensed therapist. In fact, we encourage patients to seek the support of a licensed therapist prior to the procedure. We may require that certain patients visit with a licensed therapist and attain a clearance letter prior to the procedure. In conclusion, please take the time you need to discuss the potential risks, complications, and alternatives, including no surgery with your loved ones and our medical staff. And please ensure you take the time to properly reflect on this decision. Again, we are excited that you are considering this procedure, and we look forward to continuing the discussion with you.